Reviews. Have you ever seen an ambulance speed past, lights flashing and siren wailing, and wondered what's actually inside? It's like a mobile emergency room, packed with life-saving equipment. Today, we're going to pull back the curtain and give you a full tour of an ambulance. Let's start with the driver's cabin. Up front, it looks a bit like a regular truck, but with some very important extras. You'll see the radio for communicating with hospitals and dispatch, a GPS to find the fastest routes, and of course, the controls for those famous lights and sirens. This is the nerve center of the operation, getting the crew where they need to go, fast. Now, let's step into the back, the patient compartment. This is where the magic happens. The first thing you'll probably notice is the stretcher, also known as a gurney. This isn't just a simple bed on wheels. It's highly adjustable. It can be raised, lowered, and the head can be propped up to make patients more comfortable or to help them breathe easier. It's designed to be secured firmly in the ambulance to ensure a smooth and safe ride. Everything in here is organized for speed and efficiency, because in an emergency, every second counts. Look around and you'll see cabinets and compartments everywhere. These are filled with medical supplies, all meticulously organized. One of the most critical pieces of equipment is the cardiac monitor and defibrillator. You've probably seen this on TV shows. It's used to monitor a patient's heart rhythm, blood pressure, and oxygen levels. If a patient goes into cardiac arrest, the defibrillator can deliver an electric shock to try and restart their heart. This single device is a game changer and has saved countless lives. It's a vital tool for responding to heart attacks and other serious cardiac events. Next up, let's talk about breathing. Paramedics have a whole arsenal of tools to help patients who are struggling to breathe. Find oxygen tanks with masks and nasal cannulas to deliver oxygen. But what if a patient can't breathe on their own at all? That's where advanced airway equipment comes in. This includes tools for intubation, which means placing a tube down the patient's throat to secure their airway and a bag valve mask, or BVM to manually pump air into their lungs. Keeping the airway open and the patient oxygenated is a top priority. Of course, you can't have an ambulance without medications. Paramedics carry a wide range of drugs in what's often called a drug box or kit. These aren't just painkillers. They have medications for heart conditions, like nitroglycerin, drugs to treat severe allergic reactions like epinephrine, medications to manage seizures, and glucose for diabetic emergencies. Each drug is stored securely and clearly labeled. Paramedics are highly trained to know exactly what to give, when to give it, and how much to administer. Often communicating with a doctor at the hospital for guidance. For trauma calls, like car accidents or serious falls, there's a whole different set of equipment. Find trauma bags filled with bandages, gauze, and tourniquets to control bleeding. There are also splints of all shapes and sizes to immobilize broken bones. And cervical collars, or C-collars, to protect the neck and spine from further injury. A special piece of equipment is the backboard. This long, rigid board is used to immobilize a patient with a suspected spinal injury. Ensuring they are moved as one solid unit to prevent any movement that could cause permanent damage. Let's look at some of the less obvious but equally important items. Inside these cabinets, you'll find IV kits. Paramedics can start an intravenous line to give patients fluids or medications directly into their bloodstream. This is crucial for dehydrated patients or those in shock. Also find a suction unit. This device is used to clear a patient's airway of fluids like blood or vomit, which could otherwise block their breathing. It's a simple but incredibly effective tool. What about having babies? Yep, ambulances are prepared for that too. There's an obstetrics kit, or OB kit, that contains everything needed to deliver a baby in an emergency. While it's always ideal to get to the hospital, sometimes babies just can't wait. Paramedics are trained to handle childbirth, and this kit has sterile clamps, scissors, blankets, and everything else to help bring a new life into the world safely, right there in the back of the ambulance. Too. One of the happier emergencies they get to respond to. You might also spot specialized gear depending on the type of ambulance. Some are equipped with pediatric equipment specifically for children, including smaller masks, blood pressure cuffs, and immobilization devices. Everything is scaled down to fit their smaller bodies. You'll also find personal protective equipment, or PPE, like gloves, masks, and gowns. This protects both the patient and the paramedics from infectious diseases. Safety is always a two-way street in emergency medical services. So, as you can see, an ambulance is far more than just a ride to the hospital. A highly sophisticated, mobile medical unit designed to bring emergency care directly to the patient. Every single item inside, from the complex cardiac monitor to a simple bandage, has a specific purpose and is placed for immediate access. The paramedics who operate in this small space are incredibly skilled professionals, trained to use all this equipment under immense pressure. They are the calm in the storm, bringing order to chaos and providing life-saving care when it matters most. The next time you see an ambulance, I hope you'll have a new appreciation for the incredible amount of technology, preparation, and skill packed into that vehicle. It truly is an emergency room on wheels. Thanks for joining our tour today. If you found this interesting, give this video a thumbs up and subscribe for more behind-the-scenes content. Stay safe out there.